Welcome back. Rory Johnston sitting in for Pat Nolan for this week's edition of Inside Politics. Our guest is Commissioner Randy Boyd, candidate for governor, and we continue talking about some issues. You had touched on this when you said you had 3 goals, and actually a 4th was the opioid epidemic. Yes, we know this year Governor Haslam recommended and lawmakers approved a bill to tighten the amount of dispensing opioid prescriptions. There were lots of negotiations before the final numbers were approved. Do you think it's a good bill? And what changes would you make as governor?
Well, first, I think it was an excellent bill, and it's a very positive first step toward solving this crisis. But it's addressing one of the key issues, which is overprescription. In the state of Tennessee, I think was probably discussed in the press during this year, but we prescribe twice the number of pills as the national average. Minnesota is the same population as us, and we prescribe 10 times more pills per person than Minnesota does. So we had to get a handle on the overprescription problem. So I've got a policy that I published last September that has 3 key buckets of initiatives. The first of which is we need to mobilize. We need to declare a state of emergency. We need to marshal all the state's resources to focus on this issue. And within that, we need somebody in charge, a chief epidemic officer. So we need to put the attention and the priority to this that it deserves. The second thing is prevention. And the governor's bill, the legislator's bill, focused on the prescription side of it, and which is critically important. In addition, we got to also make a major emphasis on education, working with people like the Metro Drug Coalition that teaches kids in schools about the dangers of these drugs, but also doctors and patients need to understand how dangerous they are. The third bucket of initiatives is around recovery. And one of the things that I did learn as I've been traveling across the state is the #1 place we have in our state for people with addiction issues for recovery is our jails. If you talk to a sheriff anywhere in our state, they'll tell you that 70% of the people in their jails are there because of an addiction or mental health issue. As a state, we have to make a major reinvestment in mental health and addiction recovery centers.
That's been a big push by Sheriff Darren Hall right here in Davidson County. He talks a lot about that issue. As you travel the state, do you find that this opioid epidemic, it doesn't discriminate, does it?
It doesn't. You know, a great friend of mine that I've just met through this campaign lives in Campbell County, and I've toured his county multiple times with him over the last year and a half. Last 6 months ago, we were in his city of Follett, and we're driving down the main street, and he looks over at me and says, and he had never told me this before, he says, you know, the street doesn't feel the same anymore. For the last 5 years, I drive down the street, and I'd always see my father walking down the street. I didn't recognize him, and he didn't recognize me because he had been so overtaken with addiction, but it was nice to see him there. But he just passed away a month ago. His father was 65. At 60 years old, he had a back issue. Ended up taking pain pills, got addicted. 5 years later, he died. It doesn't discriminate.
Yeah. All right, I want to talk about this specific campaign. You are out there busy and you're running some TV ads. And recently, in your ads and on your website, you compare yourself to President Donald Trump, cleaning out the swamp, disrupting government. You're a private businessman. Is there really, you worked with Governor Haslam. You're both fellow Republicans. What is it about Governor Haslam's administration that you would want to clean out or disrupt?
Yeah, no, I wouldn't say that we're wanting to, there's not a swamp in Nashville that we're wanting to clean out, but what I made the point on in my commercials was that we need to continue to bring innovation and disruption. President Trump has brought fresh ideas, innovation, and disruption. In my times working with Governor Haslam, we brought innovation. The Drive to 55 and the Tennessee Promise was innovation. Helping to bring the Governor's Rural Task Force to fore was innovation. So he's been doing innovation. I want to continue to bring innovation to state government.
You were Commissioner of Economic and Community Development, and these unemployment numbers really are fantastic. Why don't you brag more about what you accomplished with Governor Haslam? Or is it again because maybe a lot of the jobs that people have just aren't quite the high enough quality, high paying jobs that you would like?
No, actually, I'll take the opportunity to brag.
Okay.
We do have record unemployment. believe it's a team effort always, though. From the governor to the commissioner of economic development, our education system providing the skilled workers, local leadership, so it takes everybody to be successful. So I guess one reason why I don't brag is because it's a team effort, and it took us all to be successful, but we have been incredibly successful over the last several years. Unemployment is at record lows. It's the first time that all counties are have very low unemployment. We also, I'm proud to say, I've seen some big increases in the wages. In the last year that I was commissioner, we went from an average of $20 an hour for the new jobs we were bringing in to $22 an hour. And there was a real focus on making sure that we're not just bringing in any job, but high quality, high paying jobs. When we get low unemployment, it's more about the right jobs in the right places. Right jobs being higher paying jobs, and the right places making sure we're locating those jobs in the communities that need them most. One other stat that I'll share that I'm very proud of, we put a big focus on our rural communities. Our rural communities have been struggling, and it takes a little bit more effort to bring jobs there. We established an assistant commissioner of rural development, created a whole series of initiatives to help those rural communities. And during from the beginning to the end that I was commissioner, we started off with 28% of our jobs going to rural communities. In the last year, it was 45% of our jobs going to our rural communities. So I'm proud not just of lowering unemployment, but trying to do it more equitably all across the state.
You talk about those rural communities, and what you had said is one of your goals was to have zero distressed counties, and a lot of those rural communities could be considered distressed counties just by the lack of jobs and education and whatnot. And there's also a lack of health care. I want to talk a little bit about that and some of the smaller hospitals that seem to be closing up shop throughout Tennessee. And you hear these numbers about how far people have to travel in an emergency to get good care. How, as governor, do you think you can address that and maybe work with Washington too to get some federal funds?
First off, I'll just agree with the problem. You know, as commissioner, when we're trying to bring jobs to a rural community, they want to know they have a good workforce. They have to know they've got great infrastructure, a site, and roads. But the third thing is always, and where's my health care? And if you don't have a health care provider that's reasonably close and of good quality, it makes it much more difficult to bring the jobs to those communities. As governor, the first thing I'll do is go to Washington and negotiate for a block grant. It's something that the federal government is talked about offering to states, and I think it's the best solution for us for our health insurance. A block grant provides us a block of money, and hopefully as much money as we would have gotten under expansion. It's negotiable, but we're going to ask for the amount that we would have gotten. But the beauty of the block grant is that it allows Tennesseans to make decisions for Tennesseans rather than a product that's crafted in Washington, D.C. that has to solve all the healthcare issues and needs of all 50 states. We can create a program that's customized for us. I think it's a great option, and when we do that, one of the things we'll do is make sure that we support critical access hospitals, those rural hospitals that we've lost over the last several years.
Okay, with that, we are going to take another break, everybody, and we'll be back with Commissioner Randy Boyd on Inside Politics right after this.